Hello again, and welcome to part two of our microbiome series. Today, we're going to learn how the microbiome develops in the first place. So, the most formative age of microbiome development is the first 3 years of life. So, if you have a baby, consider the first 3 years of your baby's life as ecosystem rearing because, as I said, the microbiome is our inner ecosystem. So it's very important. Um, it is believed that when the baby is born, it's completely sterile, their gut is sterile, and the first stool meconium is also considered to be sterile. But there are some studies suggesting there might be, during pregnancy, an exchange of microbes between the placenta and the embryo. And we know that the pregnant mother has microbial shifts in their vaginal flora every trimester. So we don't know how that affects the baby. But what we do know is that the first exposure of the baby with microbes is during birthing. So, and it's a huge difference whether a baby is born vaginally or via C-section. If the baby is born vaginally, the first exposure will be the vaginal flora, which is full of lactobacillus. That's the good bacteria and pathogenic fighting. And if the baby is born via C-section, it is exposed to streptococcus bacteria, which is not the good bacteria. So vaginal birth is best if you can do. The next is, of course, first foods of the baby, whether the baby is breastfed or bottle fed. Mother's breast milk is usually the best, obviously. That's what nature is intended to give your baby. However, the mother's gut health and health in general is very important too, because studies have shown that the gut bacteria from the mother is directly transferred to the baby via breast milk. So mother has to be healthy. Bottle feeding, well, they're trying to improve formulas as much as possible to match mother's milk, but again, breast milk is best for natural microbes. And then, of course, the next is the early foods. What does the baby start eating? If you start giving your baby French fries, which is processed and empty calories and inflammatory, then that's not good for the microbiome. But if you start your baby on whole grains, cooked vegetables and fruits and lean meats and fish, that's perfect for the microbiome. So the more natural, the better, of course. Then is the babies comes to that age where it is mouthing everything. It puts everything in their mouth. So it start crawling. Now they're getting really exposed to the environment. We've been too sanitary lately. We're sanitizing everything. But babies' exposure to natural microbes like natural soil, pets and animals, nature in general that provides the microbes is good for the baby. However, we live in the modern world full of chemicals, full of pesticides, and the exposures to cosmetics and glyphosate and all these toxins are not very good for the baby. So you got to be aware making those two differences. The other exposure is early drugs, especially antibiotics. So antibiotics can kill good bacteria and the bad bacteria. So in the first 3 years, taking antibiotics is a big disruption of the natural development of the microbiome and is harmful. However, antibiotics are life-saving, very important in many cases, but try to avoid to give it for them for viral infection, for example, because that's antibiotics don't work for viral infections. If it has an ear infection that you can heal with natural remedies, try that. But try to stay away only if it's necessary. And if you have to take antibiotics, try to repopulate the flora with probiotics, like giving them yogurt, fermented foods, and maybe extra probiotics with it. Okay, so remember the first 3 years are very crucial. After that, 80% of our microbiome becomes stable. It becomes like a blueprint, like a fingerprint. But even the 20% you can control have a huge influence of our health and future generations of our health even, okay? So remember that. And if you want to know what the function of the microbiome is, click the follow button, and that's going to be our next episode. See you then.